Good afternoon, and welcome to our information session today on the eHealth Equality Incentive Grant Solicitation. I'm Olivia Japlin, the eHealth Programs Coordinator at the Massachusetts eHealth Institute, and I will be serving as your facilitator for this webinar. At this time, I'd like to turn this over to Judy Iwanski, Manager of the eHealth Equality Program here at MeHI.
Thank you, Olivia. Good afternoon and welcome. Okay, in today's webinar, we will present a brief review of legal considerations when responding to this solicitation, a very brief overview of the Massachusetts Technology Collaborative and MeHI, the Mass eHealth Institute, followed by a more detailed overview of the eHealth Equality Incentive Program, or eQIP. We will then review the individual components and requirements of the solicitation, including eligibility criteria, milestones, timelines, and application process. Again, my name is Judy Iwanski. I'm manager of MeHI's eHealth Equality Program. You will also hear today from Ross Venables, MassTech Grants and Contracts Administrator, and from Sean Kennedy, MeHI's Director of Health Information Exchange. Now I'm going to turn it over to Ross for a brief discussion of legal considerations.
Thank you, Judy. This is Ross Venables, Grants and Contracts Administrator here at MassTech Collaborative. Just wanted to highlight a few legal considerations associated with this RFP as we move forward. First, this solicitation has been posted to both the MassTech website and the ComBuys, which is the Commonwealth's procurement portal. To the extent that anything stated or presented in this webinar is inconsistent with the solicitation that has been posted to MassTech and the ComBuys websites, the written solicitation documents shall govern. MassTech reserves all rights to amend, modify, or otherwise clarify this solicitation and any written answers to questions presented. As we post additional material to the MassTech or ComBuys websites, we ask that you check back periodically to see those updates. It's the respondent's responsibility to check those websites for any addenda or modifications to the solicitation. And please review the solicitation carefully. Non-responsive applications may be rejected.
Thank you, Ross. I'm not going to spend a lot of time on the MassTech overview. You may refer to our website for additional information. But in brief, the Mass Technology Collaborative is a public economic development agency established pursuant to Mass General Laws, Chapter 40J. It is an independent authority of the Commonwealth of Massachusetts, and the Massachusetts eHealth Institute, or MeHI, is a non-divisible component of MassTech and functions as one of its business divisions. MeHI is dedicated to the advancement of healthcare through the use of technology. We are the designated state agency for coordinating healthcare innovation, technology, and competitiveness, accelerating the adoption of health information technologies, promoting health IT to improve the safety, quality, and efficiency of healthcare in Massachusetts, and advancing the dissemination of electronic health record systems in all healthcare provider settings that are networked through the statewide Health Information Exchange, the Massachusetts Highway. This slide shows the high-level vision, mission, and goals of MeHI, including supporting the triple aim of health reform: better population health, better patient care, and lower costs. At a high level, MeHI currently has 4 initiatives: the eHealth Equality Program, the Connected Communities Program, Meaningful Youth Support, and the eHealth Innovation and Cluster Development. This eQIP solicitation is issued as part of the eHealth Equality Program. The objectives of the eHealth Equality Incentive Program, or eQIP, to promote effective use of interoperable EHRs by eligible behavioral provider organizations in an effort to improve the quality and efficiency of healthcare in the Commonwealth while containing costs. As noted previously, one of MeHI's goals is to advance the dissemination of EHRs in all healthcare provider settings and facilitate their secure networking through the Mass Highway. Current data, including a recent MeHI provider survey, has shown that many independent behavioral health organizations, that is, those that are unaffiliated with large providers or healthcare systems, are lagging behind other healthcare sectors in the adoption of EHRs. Chapter 224 of the Act of 2012, which was the second major piece of health reform legislation passed in Massachusetts, directed MeHI to prioritize assistance to organizations that are, 1, generally not eligible for the Medicare and Medicaid EHR incentive programs, and 2, that lack access to other resources to implement EHRs. The legislation specifically referenced mental health facilities and community-based behavioral health, substance abuse disorder, and mental health care providers. For the purposes of of this solicitation, behavioral health services are defined as direct patient care services by behavioral health providers used to evaluate and treat people with mental health and/or substance abuse disorders. And the substance abuse treatment services must be provided through programs that are licensed and/or approved by the Massachusetts Department of Public Health. Behavioral health providers must provide direct patient care and either be licensed clinicians or clinical staff authorized to provide direct patient care under the supervision of a licensed behavioral health professional. Affiliated organizations are entities under the common control or governance and joined together contractually through a shared entity. There's a more detailed definition in the solicitation. Patient service revenue for the purposes of this solicitation, and it's used in the eligibility criteria, is the total of net patient service revenue, which is from third-party payers, and any payments under a state or local contract to provide behavioral health services to public payer clients. MeHI reserves the right to further define the terms used in the solicitation. The following are the requirements of any organization receiving a grant under the incentive program. Use certified EHR technology, or CERT. This can be either the 2011 edition or the 2014 edition or voluntary certification edition. All are acceptable. While CERT does not guarantee interoperability, certification does help ensure that EHRs will provide standard-based functionality that will support interoperability. An organization must submit a questionnaire to the Healthcare Information and Management Systems Society, or HIMSS, Analytics and Ambulatory EMR Adoption Model, AMRAM, to determine their EHR adoption baseline. They must develop a transformation plan, commit to achieving all 4 eQIP milestones, submit 2 midterm reports, a brief annual update due on July 1st, 2015 and on July 1st, 2016, submit a final report, and attend a grantee in-person event once annually. To be eligible for participation in the incentive program, organizations must meet all of the eligibility criteria. In the next 2 slides, we will review each of the 7 eligibility criteria. We will also review the method of substantiation required for each. First, the organization must provide clinical care, that is, direct patient care services in Massachusetts. Examples of non-clinical services are services that enable individuals to access health care, for example, case management, referrals, translation, transportation, health literacy, and outreach. To substantiate an organization must provide a statement of operations, income statement indicating patient service revenue for any 1 calendar month from June 1st, 2014 through September 30th, 2014. Again, patient service revenue is the total of net patient service revenue from third-party payers and payments under a Massachusetts state or local contract to provide behavioral health services to public payer clients. Second, the organization must hold a currently valid license to provide behavioral health clinical care programs and services in Massachusetts. Or, if the organization is not required to be so licensed, its clinical providers must have valid professional licenses to provide those programs. We're going to require the organization to provide a copy of its current licenses to provide the programs and services granted by Mass Department of Public Health, Department of Mental Health, or other state agency. Upon request, an organization must submit a list of all providers licensed to provide those behavioral health services. Criteria 3, organizations must provide primarily behavioral health services in Massachusetts. That is, the organization must receive more than 50% of its annual patient service revenue from the provision of behavioral health services in the Commonwealth. Organization must submit patient service revenue documentation indicating the percent of patient service revenue that was for behavioral health services for the last state fiscal year. Number 4, the organization must be organized in Massachusetts as a not-for-profit corporation under Mass General Laws, Chapter 156B. And provide a certificate of good standing from the Secretary of the Commonwealth. Number 5, the organization must have no financial relationship or affiliation to a healthcare system. We require the organization to provide a full corporate organizational chart showing the ownership, governance, and operational structure of the provider organization, including any parent entities and corporate affiliates. There may be an exception to this, that organizations could be part of a healthcare system if the annual patient service revenue of its parent organization is less than $25 million. Number 6, more than 50% of the organization's patient service revenue is public payer. The organization must submit documentation such as a statement of operations or income of patient service revenue for the last fiscal year demonstrating the portion from public payer. Number 7, the organization must document that it is not an eligible hospital or EH and that its providers are not eligible professionals under the Medicare and Medicaid EHR incentive programs. There is an exception to this, that an organization may have some eligible professionals if the number of eligible professionals is less than 30% of the organization's total clinical staff and the organization is either independent or the parent has less than 25 million annual patient services revenue in the prior state fiscal year. MeHI will consider other factors in the application, including how the organization intends to use health IT in light of the Massachusetts healthcare policy objectives. MeHI will contract with those applicants that meet the eligibility criteria, clearly describe approach feasibility, organizational ability and capacity, and anticipated impact, and sufficiently demonstrate organizational need and commitment to implementing an interoperable EHR and transacting on the Mass Highway. We will review these in greater detail later in the presentation. I will now turn it over to Sean Kennedy.
Great, thanks a lot, Judy. So this is Sean Kennedy. I'm going to share with you a little bit about the milestones for this particular incentive program. I want to start off by sharing some good news we have, and that we are collaborating with Executive Office of Health and Human Services and the State Innovation Model Team to offer a companion grant to this incentive program. And the beauty of that is it's going to bring some additional funding that will maximize the EHR interoperability capabilities to achieve interoperability across the care continuum, and essentially bring some undefined as of yet, but additional dollars to awardees of the eQIP program. So as part of the eQIP milestone 4, which is the connection to the statewide HIE and transactions, you are required to get connected to the highway, to exercise a use case in production, and do so with at least one unaffiliated trading partner. And you have to develop and document an approach to operationalizing opt-in for the Mass Highway. The additional SIM funding, or SIM is State Innovation Model Funding, which is a federal grant program that was awarded to Massachusetts, will assist grantees to achieve greater volume of transactions on the highway by allowing you to further build out and reinforce the connection you've established with the highway, and allow you to really develop a more sophisticated connection to the highway. That's the intent of that additional funding. While the program is closely aligned with the eQIP program, the SIM program is part of a separate agency that's not part of MeHI. They're part of the state or Health and Human Services. So while we do not anticipate a big application, there will be an application. But the basic idea would be once you hit that particular milestone, by virtue of you being awarded this grant, hitting that milestone, that will then trigger your ability to now apply to the SIM program and get those additional dollars. More to follow on that application process and the funding amount. We can't share what that is at this point. So let me walk you through some of the milestones. We're envisioning 4 milestones here. And the basic concept is we want you to develop a plan for this effort. This is roughly a 2-year effort that we're looking at. So we want you to start by developing a transformation plan. And then we've selected this HIMSS Analytics offers a model, the ambulatory EHR adoption model. And this model provides a nice roadmap for you to follow to demonstrate increasingly sophisticated use of electronic health record technologies. And we've built that into these milestones. And then that'll culminate in a connection to the highway. So walking through these milestones, we start out with developing a transformation plan. That transformation plan is going to be due within 3 months of your contract being executed. We will then want you to develop an HIE use case development form, basically saying how you intend to, what you intend on doing with the highway, who are your trading partners, what is the scenario, the clinical or operational scenario you're looking to bring into being. And then we'll have a deliverable there of once you've hit MRAM stage 1 and stage 2, MeHI will verify that you've hit that stage 2, and then you're eligible for your first milestone payment. Milestone 2 is achieving MRAM stage 3. Milestone 3 is achieving MRAM stages 4 and 5. And then finally, once you're transacting on the highway, that is milestone 4. So let me offer a little more detail around the transformation plan. So we're looking here for you to describe your anticipated outcomes. What are the operational or clinical outcomes that you're targeting looking at a better integration of behavioral health with physical health care? What is the current state of your health IT? Do you have an EHR? Do you just have a practice management system? May you have nothing? And then what is your desired future state? So we're looking for a description of that current and then that desired future state. And then we're looking at the gap. How are you going to get from where you are to where you want to be? And then we're looking for you to describe your approach to the grant and how you intend to hit each of the milestones, how advancement and use of health IT will support achieving identified operational or clinical outcomes, how the organization will protect electronic health information, and the basic timeline for major activities to include milestones 1 through 4. A key part of this is in the first 30 days of this activity, you're going to be required to submit, as Judy had mentioned previously, to MRAM. So you're going to submit an MRAM survey or an MRAM questionnaire. This doesn't have to take long to complete this questionnaire. But what that does is it establishes the baseline. Once you submit that, that's going to go into this group, HIMSS Analytics. HIMSS is a big professional development organization, the largest for health IT. Got a great reputation. They're going to analyze your submission, and then they're going to produce what they call a gap assessment. And that gap assessment is to say, one, what stage are you at? They're going to give you a score to let you know if you're at stage 0, 1, 2, 3, 4, 5, 6, or 7. And they'll also produce a gap assessment that basically says, this is what you need to do to get to the next stage. And it's that gap assessment that we want you to include or to at least guide how you develop your transformation plan. And that will also be the document that we as program managers are going to work with you on to move you through your particular milestones. So again, on the milestones, you can see the percent payments for each milestone. So once you achieve or submit the deliverables and we approve those, you will be at milestone 1, which is at 15% of the total incentive. And for a brief description of the MRAM stage 1 and 2, you're basically looking at desktop access to clinical information, use of unstructured data, multiple data sources, intra-office, informal messaging. Then getting into stage 2 is the beginning of a clinical document repository with orders and results. Computers may be at the point of care, access to results from outside facilities. That's a basic description of what stage 1 and stage 2 of AMRAM are. Then we go to milestone 2, where it's at 25% of your incentive payment. And stage 3 is described as electronic messaging, computers have replaced the paper chart, clinical documentation, and clinical decision support. Then we go to milestone 3, which is 35%. And now we're looking at stages 4 and 5. We're looking at computerized provider order entry, or CPOE, use of structured data for accessibility and EMR, and internal and external sharing of data, and a personal health record, or this tethered patient portal, so doing some patient engagement. And then the final milestone, we'll say it's milestone 4, but it's the highway milestone where you're going to be transacting on the on the highway. Now this is a floating milestone, so once you hit milestone 1, you can then achieve this highway milestone anytime after that. So that's an important point. Milestones 1, 2, and 3 will be done in sequence, but the highway milestone can be done anytime after you hit milestone 1. And as we get your scores recorded, we will get the feedback and have a dialogue with you about some elements of the MRAM that may or may not apply to you. So the example would be there is a requirement for physician order entry. If your organization doesn't have any physicians, clearly that would be a requirement of MRAM that wouldn't apply to you. So this just gives you the bigger context of the MRAM model. The MRAM model actually goes up to stage 7, and what we're doing is we're using our milestones and aligning all the way up to stage 5. That's the level to which we are interested in incenting you through a trajectory of increasing mature use of an EHR. You'll see stage 6 gets into advanced clinical decision support, proactive care management, structured messaging, and then stage 7 gets into your HIE side. By doing your highway milestone as your floating milestone, we're going to be getting you to that HIE capable. But this is where we had to adapt the model to meet some of the specific needs of Massachusetts. What I will say is that getting to MRAM stage 7 is a very highly coveted achievement, and it comes with a fair amount of recognition from him. So we would certainly be supportive and would encourage you to use that gap assessment ultimately to get up to stage 7 over the 2-year period. And then this final slide here is the tiered and graded payment structure. So you can see here where you fit on the small to the very large organizations. $1 million up to $10 million is our small organizations, 10 to 25, 25 to 50, and then greater than 50 million is that larger organizations. We have the 3 milestones. You can see the milestones are progressive payments based on the milestone for small, very large, and then the highway milestone is the floating milestone, and you can see how that has payments based on the small, medium, large, or very large. So the total milestone payments, if you're a small organization, the maximum you can receive is $33,000, scaled up to $82,500 if you're a very large organization.
Great. Thank you, Sean. Okay. We will now present an overview of the eQIP solicitation application process and evaluation criteria. This timeline slide repeats the important dates relative to the RFP. As you can see, we will be holding another webinar next Wednesday, November 12th. Final questions written questions are due November 17th, and we will post the final Q&A on November 21st. Applications are due on December 11th at 3 p.m. We are requiring both electronic and hard copy applications, and we anticipate an award date of January 28th in 2015. The next 2 slides will outline the RFP application submission process. Please be sure to follow the process exactly as it is laid out in the RFP. Incomplete applications may not be accepted. After the filing deadline, MeHI may or may not seek additional information from an applicant prior to making a selection. Then MeHI will issue a notice of grant award for each application selected for funding that will stipulate the period of performance, the targeted milestones, the terms and conditions of the award, and the reporting requirements. As stated in the solicitation, numerous documents must be submitted at the same time as the application, including a proposal narrative, which has an 8-page limit, and we'll give the details of that on the next slide, substantiation form, an officer's certification form, signed organizational approval letter stating support for the proposed project, an application summary sheet, and an authorized application signature and acceptance form. The abstract requires the applicant to provide an overview of its organization and a summary of the proposed approach to meeting the objectives of the program, including a description of their current health IT state and how the planned advancements in the use of IT will support achieving identified operational and/or clinical outcomes. It's important to note that this will be used to quickly orient reviewers to an applicant's proposal and will facilitate contract scope writing. It's important that this be done correctly, as it's the first thing that reviewers will see. The statement of need will be a description of why the organization needs the funds available through this grant program. Again, our mandate is to go with organizations that do not have other resources for adopting health IT. Project approach, the applicant should provide a synopsis of the proposed approach to adopt and use health IT, currently in use or that needs to be procured, in order to meet each proposed milestone. You have to further estimate the timeline to reach each milestone and complete the requirements of the grant by the required completion date of January 15, 2017. The EHR product, if you have an EHR, we'll have you complete a table in the attachment that requests certain information, including vendor, product, version, certification number, and a brief description of the setting of care which it is used. And the highway status, if relevant, including how it's connected. That might be by land, webmail, EHR direct. And then additionally describe how the organization is using the highway or how it intends to use the highway. Health system integration is a description of how the organization will support efforts to integrate mental health, behavioral, and substance abuse disorder services with overall medical care integration efforts. Examples might include coordinated treatment plans or maintaining continuity of care. In-kind resources is an application where the applicant describes what resources the organization intends to provide to supplement or support incentive payments to provide their estimated value. Value of investment is where the applicant describes how receipt of the incentive payment will help achieve long-term benefits to the Commonwealth and meet the state's healthcare policy goals. Examples might include leveraging health IT and interoperable EHR systems to improve patient health, coordination of care across service providers, transitions of care, or reduction in healthcare costs. Anticipated challenges, where you outline the anticipated challenges and problems that you envision may occur in meeting these milestones and ways that the organization will be able to address them. Note that each section does have a size limit and that the total narrative should not exceed 8 pages. Applications will be reviewed against the following criteria. Compliance. Has the applicant met each of the 7 eligibility criteria, including attestation and substantiation requirements? Need. Has the applicant described why they need the funding and how other sources of funds or resources are insufficient to meet the goals? Feasibility. Has the applicant described a feasible approach for meeting eQIP milestones and achieving a more advanced state of integration and use of health IT? Ability. Has the applicant demonstrated the ability to meet the guidelines and conditions of the solicitation? Capacity. Has the applicant sufficiently indicated organizational capacity to carry out the proposed approach to achieving the milestones? Commitment. Has the applicant demonstrated their commitment to meeting the intent of the grant and all 4 milestones? And finally, impact. Has the applicant submitted sufficient information to address how the organization intends to use its EHR and other health IT to support the Commonwealth's healthcare policy objectives? Great. Now we're going to open it up to any questions that have been typed in. This page just shows you that questions may continue to be submitted through November 17th and will be posted on both the MassTech and ComBi's websites. Olivia, do we have any questions?
We do. We have one question, and our first question is, for eligibility criteria number 5A, are there other substantiation methods that can be used to show that the potential applicant cannot leverage the resources of the system parent? The only substantiation listed is that the parent has annual patient service revenue of less than $25 million. If an organization has more than $25 million but no access to resources of the parent organization, is there another way to show this?
That's an interesting question. At this point, I'll say we'll have to review that question and get back to you. We will post that question and an answer on the website.
Hey, Judy, this is Lawrence. Can you hear me or no?
Yes.
This is Lawrence Dunst, Director of MeHI. The other piece of that is if the people who asked that question could suggest a potential substantiation method, we would greatly appreciate it.
Great. I'm hoping everyone heard that, but it would be of interest to us if there were a substantiation method that would document that lack of resources.
Moving on to the second question, how do we learn of the highway uses?
Oh, terrific question. The MeHI website has a section on highway use cases and a form. I will ask Sean to go into a little bit more description about that.
Sure, and we can put together a response with some links to website, some materials, and some webinars. The Mass Highway is the statewide health information exchange, and there's a number of clinical and operational scenarios that people are using. Could be using it to request a referral, using it to send a summary care back to PCP, to get a notification from a hospital emergency room about some patient that's been admitted. There's a number of different uses of the highway and some examples of organizations doing that. So we can send you a link to some of the stories or case studies that we've developed, as well as a webinar on the highway specifically around the use cases, and then it can certainly work with you during the post-award period on developing those use cases.
Great. Is this a one-time only RFP? Will it be issued again in the future?
At this time, we contemplate it's a one-time only solicitation.
All right. Another question. For organizations that are at stage 0, is there someone who could provide technical assistance in helping to understand some of the language put forth in this RFP?
We have some webinars and a lot of material on our website, and I think that many educational sources that we can provide. At this point, I don't believe there's a contemplation of technical assistance as far as coming into the site, but there are certainly educational materials and other outreach things that we can provide that can explain this better to any grantee.
And let me just add on to that. So if the question is aimed at, I don't understand some of the concepts in the RFP, which would inhibit me from submitting an application, then by all means, perhaps you could come up with a list of your questions. And no question is a bad question. So if you have a question about an acronym or need clarification on something, just write those into an email and send them to the proposals@masstech.org, and we'll get a response back to you on that. If you have other questions now you want us to answer, we're certainly welcome to do that. And then to Judy's point, if you do submit an application and you are awarded it, you've got that 90-day period to develop a transformation plan. We will have a fair amount of material available for you. We'll also have a toolkit under development that will be available to support this vendor selection process in that effort. So,
and we anticipate doing a number of webinars and meetings with selected applicants to help them understand.
Hey, Judy, it's Lawrence. I don't know whether you guys stopped talking or my phone went dead. Can you still hear me?
Hi, Judy?
Ross, can you hear me?
Yes, I just have to
Okay.
redial in.
Judy, can you Ross, you had to redial in?
I did. The connection was broken entirely. I just dialed back in.
sorry about that, everyone. Our phone disconnected automatically. We're back now.
Great.
Okay.
it may be helpful to repeat the previous question for those who didn't.
Okay, so the question was around the patient portal if I don't have a patient portal. Okay, so if I answered that question and we were offline, my apologies. The quick response is yes, that's okay. So if you do not have a patient portal or personal health record, you would not be at MRAM stage 5, which means you would not be able to hit our milestone 3. So in your transformation plan, you would describe how you're going to go ahead and do that.
And we have another question. Can you apply for a partial grant, for example, just to achieve milestone 3 but not 4?
So the intent of the grant is that you come in for the full set of milestones. So the exception to that is going to be if you are already at stage 2, meaning you have hit MRAM stage 3 already, then milestone 2 wouldn't be something that you would have to worry about achieving, and you would not get paid for. So milestone 3 would be the one that you would come in for, but you couldn't just come in for milestone 3 and not come in for milestone 4.
I think if I can just add that the intent of this is to disseminate the EHRs in all healthcare settings that network through the state HIE, the highway, to ensure interoperability and coordination of care. So it is our mission to try to bring all providers through networking on the highway. So the commitment is required to go through all 4, including network on the highway.
Great. Next question, is there any repercussion for not achieving all 4 milestones?
Go ahead, Judy. I was just going to say it's detailed in the RFP. I forget exactly where, but if organization, and the detail is in there, so we'll call that out on the final responses. But it's also in the RFP, and Sean or Judy, you guys can let me know what page it's on. But
just talk about the clawback capability.
Yeah.
Right. There is what Lawrence is referring to is there is a clawback capability if you haven't met all of them.
Yeah, Judy, that's going to be under section 2.33 milestones. That's page 7 of the RFP.
Okay. Find it here.
We'll go ahead and offer up a response to this in a formal question and answer. But there is a clawback clause in here, and if you do not meet.
Yeah, I found it. I'll read it off to you. It is in the clause that Ross just mentioned. It says if an organization does not meet a minimum of milestone 2 and the Mass Highway milestone within 2 years of receiving an award, the organization will be required to repay 50% of any incentive payments received.
All right, next question. If an organization has less than 30% of providers who are eligible professionals, EPs in the Meaningful Use Program, are those same EPs also eligible for incentives, or is it only the professionals who are not a part of the Meaningful Use Program?
That's a good question. It's time, I think, for a clarification in that the applicant for this program is an organization, not an individual provider, which does differ from the Meaningful Use Medicare and Medicaid EHR incentive programs. So it is the organization that is the applicant and will achieve the milestones.
So there are situations where we complete assessments on various state agency websites. This could be a duplicate data entry situation. Will state agencies such as EOHHS take part in the highway?
So the The Mass Highway, so the Mass Highway is owned and operated by EOHHS, and they're doing a lot of really good and hard work to get the highway connected to the various state repositories. So the example of the immunization repository, syndromic surveillance, electronic ELR are among the ones that I know are connected. There are a number of ones. I think there is a CBHI, Child Behavioral Health Initiative. That's one of the ones that falls in the behavioral health realm. I believe that is not yet connected to the highway. There's plans to get it connected. So if the highway, if there is a registry you submit to, and if it is owned by the state, there is a very good chance that it is currently connected to the highway. If you send us examples of ones you're submitting to now, we can certainly clarify if it is or is not, or the plans to do so.
Right. What if a behavioral health organization that currently has contracts with EOHHS, such as the Department of Mental Health or the Department of Public Health, decides not to participate in the information highway? Will they be penalized for recontracting?
I'm not sure I fully understand the question. We have contemplated, the reason we define patient service revenue the way we did is to include those organizations that are receiving revenue through a contract with DMH.
I guess, Judy, this is Lawrence, if I understand the question correctly, the question is about Mass Health's contracting with organizations, and we can't answer that question. That would be a question that would have to go to Mass Health. Future payments and contracts related to patient services aren't a piece of this program.
If we're missing the intent of the question, please resubmit the question so we can more accurately answer the question.
Right. So this is a clarification question from the question on eligible providers earlier. So the incentives for a small organization are $33,000 for the organization and not by eligible professionals.
Correct.
Correct.
That's it. We still have a couple more minutes if anyone wants to submit another question. The only one that we had received prior to this date had to do with the CERT requirements, whether they were required to be certified to 2014 standards. I think we answered that in the presentation, but again, the answer is it's allowed to be the 2011, 2014, or even the voluntary certification standards.
For a minute.
We'll wait for a second. I just want to remind everyone that there will be, we will do this webinar again next Wednesday at noontime, November 12th. And but in the meantime, if you have questions you want us to address at that webinar, submit them. We will be posting the Q&As on both the MassTech and the Combi's website, and we encourage any and all questions. As Sean said, that we know that there's some complexity to this, and we're encouraging eligible organizations to apply, and we would like to answer any questions we can prior to the submission date.
Hi, Judy. This is Ross. We've received one question to the proposals mailbox. I'll read that back to you. In regards to eligibility criteria number 6, which specifies more than 50% of the organization's patient service revenue must be public payer, could you please clarify if these payers must be Medicare, Medicaid, and CHIP, C-H-I-P? For example, would behavioral health contracts with DYS, DOC, etc. be applicable? Also, should we use data from a specific fiscal year to calculate the percentage of patient service revenue?
Great. I'll answer that. The public payer can be Medicare, can be Medicaid, or any other state agency. All of it is considered public payer. And as is payments under a Massachusetts state or local contract, if it's to provide behavioral health services to public payer clients. So any of those others that were cited in there, I believe, if it's for public payer clients, may be used for this revenue. It's the last fiscal year that a statement of operations or income is available. We recognize that sometimes there's a delay, but the most recent fiscal year would be the proper one. Any other questions? We can give you another minute or so, if there are any.
So one more question. What is the state fiscal year, October through October?
No, it's July 1st through June 30th.
Did we say the state fiscal year, or did we say the
We said
fiscal year?
We said the state fiscal year.
Okay.
So it runs, not the fiscal year you cited was the federal fiscal year. The state fiscal year runs from July 1st to June 30th each year. Yeah. We may consider an adjustment on the state fiscal years if your statement of operations, we're not trying to make this more difficult than possible. So, I mean, if you have it for a full year that covers the, that gets to the substantiation we're working for, we may consider that. And on the questions and answers, as we said on the timetable, the final questions will be posted later in November. However, it's our intent to take these questions and the answers and post them on the website and add to them as we get more questions and answers. So please keep checking the website, and we certainly will expect more from the next webinar. Thank you all for attending the webinar, and we look forward to your questions and hopefully applications. Thank you.
Thank you. Bye-bye.